Joining me now, Heather Higgins, chair for the Independent Women's Forum, and Tracy Walsh, a 44-year-old breast cancer survivor, featured in the new ad campaign by the Women's Independence Forum that we just saw. Heather, first to you. What are women mainly concerned about in the president's proposal?
Women are hugely concerned. I think all citizens are concerned, but we particularly hear from women. Although we jokingly refer to ourselves, IWF, as the women's group where we like men. So we have actually men who are members, and we probably could have done this ad about prostate cancer, where the differential survival rates between the United States and other countries are even more dramatic. But breast cancer is very personal to us. We lost our founder to this. We lost one of our very young colleagues who had a 3-year-old and a new baby to breast cancer. There are several members of the staff who've been touched by this, either themselves or their families. So we're very concerned, as are a number of women. We find liberal, conservative, independent people look at the experiences with the actual outcomes of these systems where the government provides the care, where the government becomes the arbiter, and it's no longer your body, your choice. It's no longer your decision with your doctor, but there's some bureaucrat somewhere who's deciding the quality of your life years and whether this treatment is good for you, who recompenses doctors based on whether treatment they provide is standard issue efficient according to their definition, not what is really right for you, because we know that medicine is really an art. And so for a host of reasons, we felt that the public needed to be educated about this.
Tracy, do you think that you would have gotten the care that you got in the manner that you received it at the time that you did in order to save your life if you had been in Canada or in England, or if we had the British or Canadian system here?
No, I think my choices of treatment would have been greatly limited if care was delayed. My cancer was caught very early. I had choices in my treatment, and I chose an option that would give me a cure much. But if it were delayed by months, the cancer could have advanced, and I may not have had as many choices in my treatment, and I would have been fighting for my life.
Did the government, Heather, even take into account the interference with the intimacy of the communication between a woman and her physician, the interference by a government bureaucrat or a set of government protocols, something that is totally alien to the American practice of medicine and alien to the relationship of a woman to her physician?
Well, one of the things that was of concern is that already passed in the stimulus bill were certain provisions that talked about the consulting power that the government would have right at the point of consultation with the doctor about what treatment ought to be. That seemed really bizarre and a little bit Orwellian to us. Particularly because if you actually know something about medicine, my understanding from talking to a number of doctors is that there are areas where they have been trying for years to determine what's the most effective way, and they can't actually quantify it. So the idea that some bureaucrat who is no longer the government acting as a referee of what insurance companies are doing, but is now the deciding arm against which you have no claim, that's really, really scary to a lot of people.
Tracy,
what was particularly scary?
Tracy, what was the treatment that you actually received, which you might have had to have waited 6, 7, 8, 10 months in Great Britain or Canada?
Well, I went in for a routine mammogram on a Friday afternoon, and on Tuesday morning I was in the surgical center having a needle biopsy, and then I had that Wednesday night, I talked to the surgeon, the doctor, who was also a friend of mine that I know socially, so that was very comforting, that I could choose my doctor when he gave me the diagnosis. And he told me my choices, my treatment, because my cancer was caught so early. And my fear is, with this plan that was written up in the stimulus bill, as Heather mentioned, is would the government have set a protocol for my diagnosis and told me what I would have to do, or only what they were going to pay for, and I would not have had a choice in my treatment. I chose a very radical treatment in choosing to have double mastectomies with my cancer because I wanted to get rid of it and not be afraid of it returning. There were other choices that I could have taken where I would leave my chances open for the cancer recurring, and I would be afraid if the government sets a protocol for my diagnosis, I wouldn't have that choice. And my hope would be taken away, my peace of mind would be taken away, and control over my own body would be taken away. And that's my biggest worry.
Heather, do you think that the American public has come to understand the dangers and the pitfalls of shifting decision making from patient-physician to government protocol?
They certainly seem to, and one of the things that is really fascinating is despite the constant demonizing by the leadership on the left and various talking heads, you find that the average citizen is actually downloading what's been written, what's been said, what the different proponents of this have actually articulated over and over, whether it's Ezekiel Emanuel or others,
Right.
And they're really concerned. They understand what this moves towards, and I think they're starting to understand that it's not just the public option that gets you there, but they've heard Reid and Pelosi and others comment that even things like the co-op plan and mandates, which sound kind of benign on their surface, are all different means to getting to this shift from individuals making their decisions to government making decisions for you.
It's still the government. Heather and Tracy, thanks very much for joining us.
You're welcome.